Hi, and welcome to this edition of the HealthHubble Podcast. My name is Carrie Plummer, and I'm the editor and content manager here at HealthHubble. Today, I'm delighted to introduce as my guest Dr Kev Chavda. Dr Chavda is an NHS family dentist based in Nottingham and also works in cosmetic dentistry, being a qualified Invisalign and ClearCorrect practitioner and lecturer. With a large social media following, his TikToks and Instagram feeds are a firm favourite with his thousands of followers under the handle of Kev the Dentist. So without further ado, welcome Kev. Thank you so much for joining me today.
Thank you very much for having me.
So I guess for those who are tuning in and don't necessarily know a huge amount about you, perhaps let's start with who you are, what you do, and what motivates you.
Okay, yeah. So hi, so my name's Kev. I'm a dentist and I'm based in Nottinghamshire in Derbyshire. And I love making people smile. And and there's a lot of stigma with dentistry being quite scary and not being very nice, and everyone hates us. So part of the things that I'm working with is trying to kind of change perceptions and change people's thought processes about how dentistry is and how it can be. So yeah.
Amazing. So we also need to talk about your TikTok inspirations too. You are what I would class as the king of social media. So tell me about those inspirations and what do you like to do kind of outside of clinic?
I don't think I'm the king of social media, but So TikToks, I love TikTok. It kind of just started out as a bit of a hobby. Dental practices were closed over lockdown, where we weren't seeing any patients, but we were just working on the phones. So if we got loads of patients ring up, which we did, then we were super busy, but there'll be periods where we didn't. So we hadn't spare time to kill. So TikTok became a thing, decided to try and learn and made a couple. And then I posted a couple on my Instagram and the likes and comments, everyone was just loving it. And then it just became a bit of a thing, like a TikTok career now. So it's kind of mixing a bit of fun and a bit of dentistry, which is what I was trying to do anyway with my social media page. So TikTok just kind of helped to raise it a couple of notches.
It's brilliant. It's something that I always look forward to on my Instagram feed because it's almost a daily thing, which is pretty awesome.
Trying to have a bit of fun. At the moment, I don't get as much time to make them or plan for them, but I'm working on it.
That's great. So how is life at the moment in clinic during lockdown 2.0? So we're just about to start heading out of lockdown into a range of tiers across the country, and both Bristol, where I'm based, and Nottingham, where you're based, are both going into tier 3 when we come out of that. So what are the major differences that you've noticed between the first lockdown, and are there any common misconceptions associated with trying to access care right now?
Okay, so, in the first lockdown, we were shut. We weren't allowed to see patients according to the government. So we were literally just on the phone, giving advice, prescribing if we needed to prescribe, but we absolutely couldn't see any patients. But this time around is completely different. From, was it a few weeks ago to the lockdown commencing, nothing's changed for us. So we are open. We've all got the PPE. We're seeing patients. It's not the same as it used to be. There's loads more rules. There's lots more PPE. There's lots more changes in general. But if you ring your dental practice, they should be able to pick up the phone and be able to see you.
I mean, it's really reassuring to be able to hear that, because I know lots of people missed out on their dental appointments during the first case of lockdown. And obviously some people do have fears about healthcare and associated risks of maybe going and seeing practitioners. But it's great to hear that obviously in terms of the PPE, you guys and your colleagues alike are all equally prepared for any of those challenges that are thrown at us as the future months come.
Yeah, 100%. Well, an article come out last week or the week before saying that dentists have got one of the lowest contracting the virus rates. So we're really, really low. PPE in abundance. It's not just about keeping patients safe. Like as staff, we want to be safe. We're seeing lots of patients every day. So yeah, I'm glad that the government or ministers, whoever sorts this kind of stuff out, has put all these kind of measures in place that we can still run and we can still help people that are in pain. And it's quite important because I literally had a patient last week who had an issue, and I was like, oh, how long have you had the issue for? He's like, oh, since March. I was like, oh, why didn't you ring us? And he said, I didn't know you were open. I said, we've been open since June. But he just didn't know.
Yeah.
Which was quite strange. Yeah. So we are open. Yeah, we are open. We are seeing patients. If you've got an issue, you should be seen. With regards to normal checkups, some practices are ready and kind of running a bit more normal, doing checkups, and other practices are still kind of trying to focus on more of emergency work and kind of remedial treatments and trying to fix issues, basically.
Sure, that's fantastic news. So moving on a little bit, now you've written a number of articles for us, which we proudly host on our website and share through our social media. Everything from kind of how to look after children's teeth, to what is a filling and how do you have that treated, and even advice and guidance on how to overcome or maybe even manage dentophobia, fear of the dentist. What sort of dentistry do you do?
Good. So I'm a general dentist, which what that mean is I do all the general stuff a normal dentist does, is checkups, fillings, cleaning, removing teeth, making false teeth, crowns, bridges. But then I also part of my daily life is I also do quite a bit of cosmetic dentistry, which includes teeth straightening, teeth whitening, and kind of just improving smiles, really.
It's a real game changer. I remember when I had my braces taken off many years ago now as a teenager, and it's a real game changer to be able to change somebody's smile and how they see themselves.
Yeah, 100%. It's not really just about the smile of the teeth. So many people say that they want a confidence boost, and it's not really about the teeth being in the right place. It's how the teeth being in the right place makes you feel. They want to like female patients. They want to go out with their girls and smile in photos. And I've had quite a few people recently saying that they're having trouble on Zoom because they've got a virtual job now, and they constantly feel like everyone's kind of looking straight into their mouth when they're on camera. So there's lots of like what is it called, psychological issues. People kind of compare with their smile. So the fact that I'm in a job that allows me to kind of help this is fantastic. So yeah, that's why I do it.
That is amazing. So what tips could you give to patients right now about their dental care? Are there any simple tips that we can follow to help future-proof our dental health?
Yeah, so tips right now, when we're in lockdown, we can't do a lot. So routine goes out the window. Some of us, we don't have to get up in the morning anymore because of furlough, and like routines all over the place. What does that mean is sometimes we might not be brushing at the right time. If we wake up at midday, we've not got our morning brush in, and we might kind of be out of routine about cleaning your teeth. Mm-hmm. And I think more important is diet. I think we've all probably gone through, even myself has gone through a stage over the last 6 months where diet's kind of not been great. And if you're at home all day, you tend to snack a bit more. You eat foods that you probably wouldn't normally eat just because you're bored. And you can kind of get into this like diet issue, which means that obviously we all know that sugar causes holes. And so I think more focus about the world we live in is more diet related now, because we've been eating and drinking maybe more than we should have. So yeah,
100%. I mean, the kitchen for me, working from home, is actually only a few steps away, which is quite a dangerous field. But obviously, as we're now kind of preparing for Christmas as well, and with Christmas food and diets often being very different to what we normally have, it's really good to have that advice of maybe just having those extra few thoughts.
Yeah, it's just about being mindful, really. Like it's normal. We're not in the same world that we used to be in. We do look for comfort within food, and that's absolutely fine as well. But if we're just mindful that we're not doing it multiple times a day,
100%.
that would make our lives dentist lives a lot easier.
For sure, for sure. So I guess finally, this year has seen a huge amount of change. There's not one person that hasn't had some sort of effect due to the case of the pandemic. And our mental health is something that has really become a real focal point. Is this something that you've seen as a clinician? And do you have any advice or golden rules that you follow to help positively support your mental health and the mental health of maybe your patients?
Yeah, I've seen it myself. Like, now that I've seen my regular patients, they're quite open with me. I'm quite open with them, and they've all spoken about mental health, and quite a few of them been counselling. I've had a small period during lockdown where I've had a bit of issues with mental health, kind of just struggling in general. But yeah, no, I feel I'm in good spirits now. But tips, tricks. I think diet is quite a big thing for me. When I'm eating better, I'm feeling better. So every morning I make myself a green drink, a nice green smoothie, and it kind of just sets me off for the day. I think also in the virtual world that we can be stuck indoors, I think reaching out to loved ones is massive. Like, video calls is not the same as sending a WhatsApp.
No.
So if you can, I know it's a bit weird trying to get into it. I think we all experienced that right at the start where I don't really want to go on video. I'd rather just call or rather just text. It was like, honestly, if you feel like once you get past that hurdle of getting into video, it's so much better. I'm actually I'm trialing it. I'm playing tonight with a couple of friends a virtual board game.
Oh, that's awesome.
So we've got a board game. Well, we're going to see how it works, but yeah, just kind of keeping that contact with family, friends, because you can't see them. Like, my family based in London, I haven't seen them for months now.
Wow.
But I'm ringing them all the time. Ring my brother, talk to my dad. So there are things that you can do, but you got to keep doing it. As soon as you slack off, that's when the problems kind of start, and then you can't really be bothered to do it. And then you feel worse, and then I think family and friends and just kind of reaching out, and I think is the most important. Yeah,
for sure. Kev, thank you so much for your time today. It's been great speaking to you. Now, obviously, like I said, we host quite a few of your articles online. So for those people who may not be familiar with your writing, you can hop on over to healthhubble.com and look in our article section. But equally, to get more of Kev's spotlight and to take part and view some of his social media content, which is really diverse, really engaging, really entertaining, you are under the handle of @Kev the Dentist. Thank you so much for your time today. It's been a real pleasure, and thank you for joining me.
No, I've had a great time. Thank you to HealthHubble for having me.
See you soon, Kev.
All right, no, thank you.
Bye.